Men's Health 101 Health Education Seminar. Notice, the information presented in this presentation is for informational and educational purposes only and should not be used to diagnose or treat any known or unknown medical symptoms or conditions. If you are experiencing any signs or symptoms of illness or think you have a medical condition, it is recommended that you consult your physician. Today, we'll discuss why it's important to you, the facts, what it means to you, provide you with quick tips, cover some of your wellness tools, your next steps, and finally references. You may be wondering why you need to get checkups on a regular basis. Maybe you're thinking to yourself, I only go to the doctor when there's a problem. But would you allow your vehicle to go for years without a tune-up or an oil change? Let's check out the checkup timeline. Checkups that are recommended for men in their 20s include a regular physical exam by a primary care physician, and this should include blood pressure, height, and weight checks. Screenings for testicular cancer, including monthly self-exams, cholesterol testing every 5 years, and depending on your individual circumstances, your doctor may want to do an electrocardiogram to check for heart disease, and maybe even blood tests to screen for diabetes, thyroid disease, liver problems, and anemia. Depending on risk factors, your doctor may also recommend screening for skin cancer, sexually transmitted diseases, and HIV infection. For men in their 30s, you should also be including vision examinations and screenings for coronary heart disease in individuals with strong family history or risk factors. Men in their 40s should be thinking about screening for prostate cancer. Also, diabetes screenings every 3 years once you turn 45. For men in their 50s, you'll want to pay attention to annual screenings for type 2 diabetes, screenings for colon cancer with fecal occult blood testing, sigmoidoscopy, or colonoscopy at age 50. Screening for coronary heart disease in individuals with strong family history and or risk factors is recommended. You should also get screened for depression at this point. Men in their 60s should think about screening for osteoporosis, as well as dementia and Alzheimer's disease, just to be safe. And of course, all of these guidelines go by recommendations from your personal physician. More men die from heart disease than any other disease. Prostate problems are very common in men after the age of 50. Many doctors believe men under age 70 should have a yearly prostate-specific antigen test. Some studies have found that men taking testosterone have more cardiovascular problems like heart attacks, strokes, and deaths from heart disease. Risky driving behaviors are common among young males prone to externalizing behaviors such as substance abuse and crime. And being overweight puts men at risk for diabetes, heart disease, high cholesterol, and high blood pressure. Men in the U.S. get prostate cancer more than any other cancer, except for skin cancer. About 1 in 5 men will be diagnosed with prostate cancer. Little did you know, there are many different prevention strategies out there that are important to pay attention to. Studies have shown pomegranate slowed growth and spread of prostate cancer cells. 3 types of prostate cancer cell lines were treated with either pomegranate extract, pomegranate juice, or 2 of their bioactive compounds. All pomegranate treatments were shown to increase cell death and decrease the spread of cancer cells. Different parts of the pomegranate fruit have bioactive compounds that cause actions in the body that may promote good health. Soy foods contain many phytochemicals that may have health benefits. Many of the compounds in soy foods affect many pathways in prostate cancer cells involved in the growth and spread of cancer. Many population studies and clinical trials have been done to find out if soy may be useful in preventing or treating prostate cancer. In a 2009 study, patients with locally advanced prostate cancer were treated with vitamin D. The study reported that 1 in every 5 patients who took vitamin D had improved PSA levels. Studies also suggest diets high in vegetables may be linked to a lower risk of prostate cancer. More men die from heart disease than any other. The underlying cause of heart attack is coronary heart disease. Lifestyle roles play a huge part in keeping your heart healthy. Being overweight, eating a poor diet with fatty foods, smoking, and being inactive all increase your chances of getting heart disease. And if you're over 45 years of age, talk to your doctor about having a heart health check to assess your risk of having a heart attack. To reduce your risk of heart attack and aid your recovery, you should be To reduce your risk of a heart attack and also aid your recovery, you should be smoke-free and avoid secondhand smoke. Enjoy healthy eating. Stay physically active. Achieve and maintain a healthy body weight. Maintain your social and emotional health. Control your blood pressure and cholesterol as advised by your health professional. Take medicines as prescribed by your doctor.